What's the end game here for Australia?
The end game is a vaccine. Without a vaccine, there's really no certainty around where we're going and how we're going to get out of it, because there is a pandemic that's going on. It's getting worse, and it's really the worst pandemic of anyone's lifetime, of most people living today. Arguably, it's even worse than the 1918 Spanish flu. So, we can wish that it wasn't there, and I think we can look to Sweden as an example of the sort of fallacy that if you just carry on as normal and let the disease rip through the community, that everything will be fine. They did not have any economic benefits from doing so, from what I understand, but just had a much higher death toll and, much higher burden on their health system, and a lot of preventable deaths and illnesses that occurred as a result.
We are, though, seeing a lot of these arguments re-emerge now that were prosecuted early on in this about elimination or suppression or, as you describe it, letting it rip. But the circumstances are different now because we've had months of the economic impact of this too. Do you have a view as to whether our current approach is still the right one? Suppression?
Yes, it is the right one. And there isn't a choice between disease control and the economy. If you don't control the disease, the economy is going to fare worse. So really you have to just find that balance between allowing as much economic activity as possible and at the same time, managing the disease so that you're minimising morbidity and mortality, the deaths and the hospitalisations, and keeping your health system still standing.
Do you think it's inevitable now that New South Wales ends up doing something similar to Victoria and instituting additional lockdowns?
I don't think it's inevitable, but it's possible, particularly because there would have been a lot of movement between the borders from Victoria to New South Wales in the weeks leading up to the lockdown, to the border closure. And we don't really know yet. It'll still take a few weeks to really know whether there are any other silent epidemics growing in the community in New South Wales.
New restrictions, I understand, are being introduced tomorrow on pubs in New South Wales, the size of groupings. Are these changes enough?
I think the gatherings inside places like pubs and enclosed environments, they're the most problematic because we've heard of a lot of outbreaks in these enclosed settings where there isn't necessarily good ventilation. Sort of outdoor gatherings are much safer than indoor gatherings of large numbers of people, particularly when you can't track who's come in and out of those places.
All right. We also had a lot of questions about masks, so I need you to give us the simplest answer you can on this. Do they work? Should we be wearing them?
Yes, masks work. They prevent both transmission of infection if you are infected. So that the thing about COVID-19 and what's really diabolical about it is that people can have no symptoms at all but be infected and infectious. So people with no symptoms who don't even know that they're sick can be spreading it. So if you're wearing a mask and you are infected and don't realise it, you are much, much less likely to spread it to other people. And also wearing a mask will protect you if you're well from inhaling contaminated droplets or being coughed or sneezed on. So it works both ways. There's a lot of evidence now that masks work both against other respiratory infections and also from a WHO Commission study on COVID-19, SARS and MERS coronavirus.